we must be diligent in the daily battle that takes place. It is not uncommon to see people go through major stress, divorce, bankruptcy, death of a loved one, and then come to find out a year, 2 years later, they've developed cancer. It's because the immune system has been weakened to the point that those cells are now starting to double. And once they start, their momentum makes it harder for the immune system to kill them. So we take an action, maintaining a healthy immune system. One of the greatest risk factors for getting cancer is ever having had cancer in the past. You've demonstrated that your cancer-prone genetic endowment is no longer that relevant. You have had cancer. Now comes the question, what do you do so it never comes back again? Or what do you do so that you're less likely to get some other form of malignancy? It's an uncomfortable thing to contemplate, right? We like to believe, Timmy cured cancer. Susie is cancer-free. Ring the bell. It's been 5 years. I am done worrying about cancer. Well, you should never worry. You should always take thoughtful action. So where does this go? If you're cancer-prone, how do you react? It's secondary prevention. In intellectual medicine, we developed an approach based upon research, clinical as well as cellular, to make your body resilient toward cancer. To do so, we have to appreciate a few facts. 1, cancer has a horrible propensity to return, sometimes years, even decades later. Many of you have heard this story or are personally exposed to people, women, who were treated for breast cancer when they were 52. And things went great. And then at 68, it came back with a vengeance. The cancer was everywhere, and they died shortly thereafter. This is a sadly frequent scenario. And the reason, I believe, is because we're ignoring secondary prevention. All that is done in most cases with breast cancer, we'll focus on that for a moment, is a cycle of treatment, sometimes followed by hormone suppression therapy, and that's it. Hormone suppression therapy has many side effects: increased dementia, osteoporosis, hip fracture, heart disease, vaginal atrophy, sexual dysfunction, the list goes on. Really? Is this the best we can do after trillions of dollars spent on research? You don't build buildings and you don't have profit when people don't get sick. So the motive to look for means, natural, inexpensive, readily available means to prevent cancer from coming back is not that great, folks. It just isn't. They're not evil people in the pharmaceutical industry. They're just focused on what can return profit. They're not bad people in oncology. They're heartfelt. They're just focused on treating disease that hits them every day. Rates of cancer go up. Incidence of cancer is happening in younger and younger people. What's going on? We're ignoring what's right in front of us, secondary prevention. So we have to then acknowledge this is a big problem. In fact, it is a known risk. Whenever you've had chemotherapy or radiation therapy, you have now been exposed to a carcinogen, and there will be an increased incidence for the rest of your life for lymphomas, leukemias, and other forms of secondary malignancies. The primary cancer was treated. The treatment itself lit the fire for a secondary malignancy. Now, sometimes that's necessary, right? You have to go through primary treatment, but it doesn't mean that you should ignore the facts. Breast cancer, early stage 1 breast cancer from the New England Journal of Medicine, tracking women out for many years. Stage 1 breast cancer has a very good prognosis. The death rate after 5 years is exceptionally small. However, when you follow the woman long enough, 10, 15 years, the relapse rate skyrockets, going over 10%. And the rate goes even higher if the cancer was originally a stage 2 or stage 3. And when it comes back, folks, it doesn't come back incrementally. It doesn't come back in a localized area. You can't tell where it's going to hit, and it hits everywhere. To understand this phenomenon, we must comprehend the difference between cancer cells and tumors. Tumors are what they look for when they do imaging. A tumor, folks, I don't care what stage it's at or how big or how little it's perceived. A tumor is a relatively late finding in the evolution of cancer. But what about early detection? What about a tumor is a late finding? In order for a tumor to be seen, in general, it needs to be about a centimeter in diameter to be declarative. Well, it takes a cancer cell about 30 doubling times to get that big. What's a doubling time, you ask? A doubling time is how long it takes one cancer cell to become two. It is the growth rate, if you will. Now, it's not a constant phenomenon for every cancer, but it is a phenomenon. There is a doubling time. And when those cancer cells are milling about and doubling, you can't feel it. The CAT scan cannot see it. The blood test does not reveal it. Now, they see a tumor, that's 30 doubling times. Well, if you get to 40 doubling times, you're likely going to die from cancer. So that 1 centimeter tumor, not really an early stage disease, right? It's relatively late in the game, which means we got to take an action sooner. The irony, the difficulty, is you must take an act when you feel great and before the cancer is even present. However, that act cannot be toxic. After all, you feel good, you're healthy. Why in the world would you expose yourself to poison? Why in the world would you suffer the consequence of perpetual hormonal depletion? It is a horrible way to go about secondary prevention. Far better to analyze what were the carcinogenic risk factors that you had at the first place and how do you modify them. 90% of risk factors are environmental. That's good news. It's good news because you can change the environment. Among the things that we see, and I've done this test for over a dozen years, we see enormous rates of toxic metals inside the human body. I'm not talking about the stuff that's out there. That's bad enough. I'm talking about how it gets inside of us. And how does it get there? We breathe it, we eat it, and we drink it. It's in the water, the food, it's in the air. It's a side effect, it's a consequence of industrial manufacturing by and large. The things that I see that are most prevalent, cadmium and lead. Now, cadmium is a class 1 carcinogen. If cadmium were in the dirt around your house, you'd have the dirt removed. If it were in your house, in the building material, you'd have it replaced. How about if it's inside your body? That's a problem. The other problem is nobody knows how to test for it, by and large, or what to do about it. Well, we do. The test for it is called a provocative heavy metal test. Because cadmium is resting inside your cells, inside your tissue and organs, it must be pulled out in order to be analyzed. Now, some people have speculated, isn't it better to let it lie there sleeping? No, it doesn't lie sleeping. Cells are constantly turning over. And as they turn over, they're releasing these heavy metals into the system, assaulting the cells, imposing on their DNA, instigating malignancy, perpetuating and fomenting cancer growth. So you got to test for it to get a baseline. Do you really need to test for it if everybody has it? Well, that is an existential question. Maybe you could just go ahead and detoxify. But how? There is nothing generic, over-the-counter, that detoxifies or removes cadmium or lead. These promotions are just that, promotions without proof of outcome. We have proof of outcome. After 10 years, published studies in medical journals that have been produced from our center have demonstrated we can absolutely reduce these metals. So you get rid of lead. Lead damages the heart and the brain and has carcinogenic capacity. How about cadmium? Very hard to get rid of cadmium. Very hard. There's not much that I've come across, and I've been researching this for 15 years, looking for a way to get rid of cadmium. Intravenous chelation can help, but it's not good enough. Therefore, in our research, we've been able to discern that dimethylsuccinic acid, DMSA. It's a prescription drug that can be compounded by FDA-approved pharmacies in a manner that has a potential to lower your cadmium level. This, folks, is nothing short of a breakthrough. This is phenomenal. With a capsule that you take at home, the protocol that we've developed is 2 capsules 3 times a week. You can lower cadmium levels. Why is that so thrilling to me? Because it's never been shown before. Cadmium is very sticky, and when it gets in, it has trouble getting out. Now we have a means of doing that. So secondary prevention, let's get rid of the carcinogens that surround us. Lower the cadmium, lower the lead. At Intellectual Medicine, we've developed these protocols. We have the means to do it. But what else should you do? Fat correlates with cancer, period, end of story. There is no there's no weight loss drug that is uniquely endowed with anti-cancer property. I know we're reading a lot about Wegovy, about Ozempic. They're nice drugs. We use them in our center. They can help with weight loss. But they're being way overhyped with regard to their collateral benefit. You take anybody who loses percent body fat, not weight, folks, not weight, fat. Weight loss does nothing to help you. Fat loss does. Anything that healthfully gets you there has the ability to lower cancer risk, lower heart disease and dementia risk, but cancer in particular. Women who lose weight, who lose fat after a diagnosis of breast cancer have a lower incidence of relapse. The same with men and prostate cancer, the same with just about every cancer that's been looked at. 14 different cancers have been correlated with excess adiposity. So we're getting rid of lead, we're getting rid of cadmium, we're dropping percent body fat. And yeah, you can do it with pharmacology, but don't forget, it's got to be matched up with nutritional behavioral change. Not intermittent fasting. Intermittent fasting is a horrible idea. You should never do it. It compromises health. It does nothing to support longevity. It does nothing to support anti-aging. That is a colossal misinterpretation of the data and a misleading pathway that lots of people are trying to capitalize on. So you've been forewarned. I'll talk more about that in a future podcast in all of its detail. Suffice it to say, don't do it. You will shrink, you will lose muscle, you will lose bone, and you will not have better health. You must eat, folks. You must eat at least 3 times a day for the vast majority of you in order to hold muscle and lose fat. I don't know why we're made that way. We're human beings. We have huge brains and relatively tiny stomachs compared to other mammals, other ape-like mammals. So we have to eat all the time. It's an interesting question, like why were we made that way? Is it so that we would be forced to socialize so that we could get food? Is this part of the grand plan? Questions I have to ask upon arrival or past the pearly gates, that's one of them. In the meantime, we live with the hand that we're dealt. So shrinking fat, getting rid of toxic metal, cadmium. What else can you do? Well, I was talking a moment ago about cancer cells. A cancer cell, we believe, happens to all of us frequently. But those cells are identified and killed by our immune system. Therefore, we never know that they were there. They never become tumors. Remember that 30 doubling time? That can take 7 years or longer, depending on the type of cancer. So at 5 years, if your scans are free and clear, that's nice, but you're not out of the woods. We must be diligent in the daily battle that takes place. It is not uncommon to see people go through major stress, divorce, bankruptcy, death of a loved one, and then come to find out a year, 2 years later, they've developed cancer. It's because the immune system has been weakened to the point that those cells are now starting to double. And once they start, their momentum makes it harder for the immune system to kill them. So we take an action, maintaining a healthy immune system. I love vitamin C as a routine supplement, 2,000 milligrams a day. Why? Because it helps the immune system. Why? Because it helps collagen formation, which the body uses to make walls around cancer. And I love it because we don't make it. You realize, no, you don't, I'll tell you, we're just about the only mammals that don't make their own vitamin C. It's the great apes, humans, and guinea pigs. All the other mammals make vitamin C. And what have we learned from that? We have learned that when under stress, the amount of vitamin C that a mammal makes skyrockets. It's a bit like cortisol. So it is an environmentally dependent vitamin. Yes, the RDA will prevent scurvy, but it'll do a little more. The amount you should take, I said up to 2,000 milligrams per dose. Research has shown us that if you take beyond that amount, you can't generate higher blood levels. So there's uncertainty regarding if higher doses have merit, but more frequent doses may. So if you're under the gun, double up, take it twice a day, as long as stomach tolerates it. What else? Vitamin D. The studies on vitamin D published in the New England Journal of Medicine declaring that it's not worth the effort because it has no impact on cancer, disease, infection are dramatically flawed studies and should be disregarded regarding the role of vitamin D. And here's why. In those studies, they were observational. They asked people, hey, how much do you take? And the people took on average 2,000 units per day. In my practice, I guide patients toward a minimum of 5,000. The other problem, they didn't test blood levels on these people. In the few who had blood levels tested, it was rare for them to have a blood level above 50. We consider 50 to be the minimum threshold to garner the benefit of cancer prevention, of infection prevention, to gain the minimum of all the health benefit. Now, there is such a thing as too much vitamin D, so you don't want to pile more on just because you think more is better. I do not advocate for anybody to walk around with a vitamin D level above 100. There's evidence it could cause harm. That's a big window. It's hard to go over 100 unless you're doing something very extreme. The point is that you should be talking to your healthcare provider. I would say your doctor, but unfortunately most doctors look at New England Journal of Medicine. Well, it's not unfortunate. The New England Journal of Medicine is a fine journal with important work being published. However, when they publish something that is wrong or misdirected, it has a tendency of petrifying thought. People stop asking questions because it was the New England Journal of Medicine. That's the same journal, by the way, that published the HCG diet, which we now know is baloney. So, with respect to the journals, we always have to be inquisitive and ask questions, and we need to be a little bit challenging. So with vitamin D, so it goes. So we got vitamin D, I got vitamin C. That is where we come in with high-dose intravenous vitamins. We've developed an infusion at Intellectual Medicine. We call it cancer chelation. It is a fantastic blend of high-dose vitamin C with the potential to kill those stray cancer cells, right? Whack them when they're floating around before they become tumors. They become a tumor, they're like an army that has now fortified its defensive position. When they're floating around as like little lonely cells, they're like a lost troubadour just waiting to get whacked. That's where the vitamin C comes in. Included in the infusion is alpha-lipoic acid, which disrupts mitochondrial energy production of cancer cells. Well, that's kind of cool, and it does so without mucking your natural cells. Then there's magnesium, and then there is zinc, two critical micronutrients to support immune function. And then the piece de resistance. There is calcium EDTA. Why? Because that pulls out toxic metals. This approach is utilized not only to lower some of the carcinogenic metals, but also to protect heart and arteries. This is supportive of arterial health based upon our research, where we've been able to demonstrate, in many cases, an improvement, a lowering of hardening of the arteries when people do this type of an approach. Affordable, safe, once-a-month infusions in combination with the other things that I mentioned. There are other things as well worthy of consideration. Secondary, I should say, repurposed drug therapy. When we take a drug that has already been FDA approved for some other purpose, but now we've discovered it has value preventing cancer. Low-dose naltrexone has some of that value. It may interfere with and prevent cancer from moving beyond their boundaries, metastatic interference. Doxycycline at low dose functions not as an antibiotic, but as a cancer stem cell killer. Fascinating, once a day, cheap and safe. Metformin has been correlated with lower cancer incidence. For the right person, a consideration. It also can help with weight reduction. And here's one I absolutely love to help prevent cancer relapse. It's Sirolimus, also known as Repurposed. Taken in low dose once a week, Repurposed interferes with cellular degradation, making the mitochondria healthier. The mitochondria is the part of the cell where it's felt cancer begins. Whoa, isn't that cool? So by virtue of implementing a thoughtful, affordable, and safe pattern of secondary cancer prevention, you get the collateral benefit of protecting yourself or lowering your risks for other forms of malignancy. And oh, by the way, everything I'm talking about points toward brain health and arterial health. So do not be idle. This is my message. Cancer is worthy of attacking when you can't see it, feel it, when the imaging does not show it. It may be there at a cellular level. And as such, it's vulnerable. It's vulnerable to your immune system. You don't need chemotherapy. You don't need to block hormones. You need to be cognizant of the carcinogenic factors blowing in the wind that nobody seems to care about, except for those of us dedicated toward preventative primary health and vitality. It's not a coincidence that lifespan has extended, but health span has shrunk. We're spending more of our last years sick. Nobody, very few, I should say, are advocating for you to not get sick. Well, at Intellectual Medicine, that is our primary focus. So thanks, folks, for spending a little time with me on this podcast. I hope you never have to deal with these issues, but let's tilt the field to our advantage. Let's be proactive with our health, and let's go beyond drugs, and let's go beyond waiting to get sick. Thanks for the time. I'm Dr. Petteruti, Intellectual Medicine. All right, see you next time. Bye.